Alterations in cognition and sensation, neurologic deficits. One or more functions of the central nervous system or peripheral nervous system are going to be decreased with neurologic deficits. It can also be impaired or absent. It often affects more than one body system, and examples would include paralysis, muscle weakness, an inability to recognize objects, impaired speech, memory, swallowing, abnormal gait or difficulty walking, and abnormal bowel or bladder elimination. It is divided into 3 phases: acute, recovery, and chronic. All phases are not necessarily experienced by all clients. So is the following statement true or false? One or more functions of the CNS or PNS are decreased, impaired, or absent with a neurologic deficit. This is true. With the acute phase, we see a sudden neurologic event and the client becomes critically ill. Medical and surgical management will include stabilization and prevention of further neurological damage. It may include drug therapy, mechanical ventilation, and surgical interventions. Nursing management includes frequent neurologic and physical assessments. We may use the Glasgow Coma Scale or the mini mental status examination, and we may also do basic rehabilitation interventions. And definitely we need to be preventing complications. The recovery phase begins upon stabilization of the client's condition, and it can last weeks to months. Medical and surgical management will be involved in keeping the client stable and prevention and treatment of complications or further neurologic impairment. Nurses need to do a continual assessment of the client's abilities and their potential, and we can also use different assessment tools to help us provide a measurable diagnostic of where the client's at. And we can also assist in planning their rehabilitation program. In the chronic phase, the client will exhibit little or no improvement, or they progressively worsen. Medical and surgical management include rehabilitation rationale to help prevent complications, or surgery rationale to correct resulting problems. Nurses should help prevent physical and psychological complications and assist in the retraining of their skills. Primary aims of medical treatment during the acute phase is going to be to stabilize the client and prevent further neurological damage. During the recovery phase, the aim is going to be keeping the client stable, again preventing or treating any complications such as pneumonia and further neurological impairment. And during the rehabilitation of the physical and psychological areas, we will continue in the chronic stage. Again, we help prevent complications such as pressure ulcers and muscle contractures. So, is the following statement true or false? Medical management during the chronic phase aims to keep the client stable and prevent or treat complications such as pneumonia and further neurologic impairment. That was false. That is actually going to be the second stage, the recovery phase. I apologize. So team members that may be involved in the healthcare management would include the physician and the nurse, the nursing assistant, social worker, physical and occupational therapist, speech therapy, maybe a prosthetist or dietitian, a psychotherapist, the pharmacist, and a vocational counselor. So returning to home issues are going to include fear, an increased need for support, caregiver burden, financial strain, home adaptation, and a relearning of employment skills. Nursing management includes evaluation of the client's abilities, their identification of problems and needs, assessment of needed assistance, their individual coping skills. Do they need reassurance and emotional support? Empathy can be provided through support groups. We can look at solutions or possible alternatives to issues for home. Socialization will include the health team, the family, occupational and recreational therapies. Family processes are going to have changes in acceptance and processing the issues. Communication, they'll need to be able to vent to people. And they should also participate in rehabilitation. And nurses should also provide client and family teaching. So is the following statement true or false? Neurologic deficits only affect the nervous system. That is false because neurologic deficits often affect more than one body system.